For those that don't know me, my name is Jason Madden. I'm the Vancouver campus manager here at IHN, and really excited to be hosting today's guest speaker talk. This is a topic that has been kind of popping up for me, and I'm looking forward to learning a little bit more today. So I'm glad that all of you are here as well. So we're going to have an opportunity for questions at the end. So throughout the talk, put your questions in the Q&A function at the bottom of your screen, and then we'll make sure that there's time at the end to get into some of the questions. So yeah, thanks for being here this afternoon or morning. It's morning here in Vancouver. I don't know where everyone's tuning in from, but for those of you on the East Coast or maybe abroad, I know it's afternoon or maybe even evening. So welcome. We're here to dive into the fascinating world of peptides and bioregulator peptides. And today is Nathalie Niddam, who's a CNP and graduate of IHN. Nathalie is also a human potential coach. Several years ago, she discovered peptides at a health optimization conference and was captivated by their potential. This became the catalyst for her to establish the Optimizing Superhuman Performance group on Facebook, a large and growing community interested in these compounds. A year later, she launched the Biohacking Superhuman Performance podcast, which is now ranked among the top 50 in its category in US and Canada. Nat's passion lies in viewing longevity through the lens of promoting vibrant health and boundless energy across all aspects of our lives, with a focus on maintaining a healthy mind and body. So, Nathalie, thank you for being here, and I'll throw it over to you.
Thank you. Thank you so much for having me. I appreciate it. So yeah, it's a very interesting topic. It's a big topic, and I think that, when I first discovered peptides at a conference about, I guess it's going back 4 years now, the doctor standing on stage said, "This is going to revolutionize medicine." And it actually is, and it will. The question is going to be how fast it's going to happen and how much is pharma going to kind of intervene in the process. Definitely peptides are, what makes peptides so fascinating is that they are known to your bodies, right? The way where they come from is from the human body. And sorry, I apologize. Let me just put myself on Do Not Disturb here. I should have done that before. And so we know that when we introduce something to the body that it recognizes, it can manage it, it can get rid of it, it can process it, it can deal with it in different ways. It's like kind of bioidentical hormones versus synthetic hormones or estrogenic compounds that are not actually estrogens that bind to receptors, and right. So when the body meets something that it knows and recognizes, it can deal with it and use it much better. And plus, that compound will have more respect for your own biology than any other compound will. It's a funny way to say it, but it's kind of like the best way I have to express it, in that it doesn't turn things off. Unless it's a gene that is harmful to you, it will and we'll talk about some of these peptides, but, for example, we have peptides that help to stimulate the release of your own growth hormone. Well, that means that it doesn't impact any negative feedback loops. It doesn't negatively impact your production of your own growth hormone. It simply gives your body the impetus to make more growth hormone. And it'll never deliver like exogenous growth hormone would. But the challenge, of course, with administering exogenous growth hormone is it will eventually shut down the production of your own. And that's, in some cases it's appropriate, but it needs to be medically supervised. That's a whole different kettle of fish. So anyway, the presentation I'm using today is a presentation that is focused on women. I'll include the boys as we go. All right. So all of us sitting here, all grads of the Institute of Holistic Nutrition, and anybody in the space who has any sense about them knows that ultimately there is nothing in this world that matches the innate intelligence of our bodies. Our bodies are able to heal on the fly. They're able to regenerate. They can kind of fix themselves. Like it is amazing what the human body is capable of. The bad news is that even with all that kind of built in, and I don't know if this is hiding your image like it is mine, but all that built in, we still eventually, those capacities to heal and regenerate become overwhelmed with age and with exposure to toxins and with illness and all the things. And so inevitably, we experience a decline in our function, in our ability to do things, both cognitively, physically, physiologically, the whole nine yards. So, Mother Nature has a very distinct playbook for us, and it doesn't involve particularly living to 120 or 150. And not that we should all strive for that, but Mother Nature's playbook really takes care of us really well through our reproductive years and after them so that we can take care of our offspring. But once we're done with that, her playbook is you're going to fade off into the distance and the next generation is going to come up. And, from an ethical perspective, perhaps this is what we should accept. But definitely in modern world today, we don't want that, right? We have bigger plans. We plan that in our 60s, 70s, 80s, and even our 90s, we're going to be contributors, we're going to be producers, we're going to enjoy life, we're going to be vital, and we're going to continue to function at this level that allows us both to enjoy life and to be contributors to the world. So without getting into the ethics of it, this is where the whole biohacking health optimization space is. And we know whether you're a biohacker, no matter how you identify yourself, we know that our medical system is really not well equipped to deal with this whole aspect of longevity. The medical system really is really designed around treating illness. And so, for all of you who've gone through the IHN program, whether you've gone through it in the past or you're going through it now, you know that there's a lot more that can be done and a lot more that needs to be done to maintain health, to avoid finding ourselves in this particular situation. And so the trick is to tap into the wisdom of the body. The trick is really to how do we kind of tap into this system and how do we kind of reignite it so that we don't experience that decline in the same way that just seems to be built in. So bioregulators and peptides is going to be what we're going to talk about today. They are very powerful tools, but I want to preface this by saying, and I will say it later in the presentation as well, there is nothing that precludes nutrition, like proper nutrition, proper exercise, proper getting outside in nature, getting proper sleep, managing your sleep. Like those foundational pieces of the puzzle are non-negotiables. And so everything that I'm going to talk about today is predicated on establishing and maintaining and working towards that foundation. Sometimes these compounds can help us to get an edge and make progress when, we're really down. But for the most part, all of these things will work better and will work best when we're also doing everything else. So I don't want anybody to think that these are a silver bullet, because they're not. So as I said before, we make them. Right. And we make peptides in our own bodies. The bioregulator peptides, which many of you may not have heard of before, are 2 to 4 amino acid chains. They're tiny, tiny little proteins, and we produce them in our body. And those peptides, as well as, many other reasons, is why this little child, if she falls and skins her knee, within a couple of days, she's healed. If grandma falls and skins her knee, it might take a lot longer for her to heal. So her body is not as good at healing. All of those mechanisms of healing start to fail and start to diminish as we age. And part of that is because there's a change in the availability of these signaling molecules. So let me just see what happens here. Okay, so the benefits overall of peptides and peptide bioregulators, this is very, very broad. And I would say the top two, the anti-aging, biological age reversal, and the organ rejuvenation, this is really the land of the bioregulator peptides, whereas tissue repair and upregulation and downregulation of pathways is going to be more in the realm of your longer chain peptides like the BPC 157, the thymosin alpha 1s, thymosin beta 4. So if I could see you guys right now, I'd be asking for a show of hands, like how many of you are familiar or have heard of any of these peptides. And I know there's one person for sure in the audience who I know who's heard of them a lot, but I don't have a good sense of how many of you guys know anything. So I'm going to assume very little. And we'll go from there. So, like I said, this presentation I created for a women's conference. So I'm going to talk more specifically about women, but at the same time, I will tell you that men can benefit just as much, right? So we have hormone balancing. And when we're talking about hormones, we're talking not just about sex hormones, we're talking about adrenals, we're talking about the thyroid gland. For women and even for men, we're talking about fertility because, as we all know, fertility has been tanking over the last few decades and for a number of reasons, including our environment. Menopause in women, men have andropause. There's that, we're seeing more and more younger men looking for testosterone replacement therapy. And, in some cases, it's lifestyle driven, but in many cases, it's environment driven. And so a lot of these things are related, and a lot of them can be helped with peptides to a degree. We then have digestion. So metabolic issues, digestive issues. I know that you guys are talking about this a ton in class, and I don't want anyone to think that all of this stuff is going to replace all of the valuable information you're getting, but as an addition to, it can be very, very powerful. Cardiovascular health, we know that as men have cardiovascular issues or are more prone to cardiovascular issues younger than women. But once we go through menopause, we join the team. We become just as prone, or if not more so, because we're not diagnosed as effectively. Maintaining and building lean muscle mass. This is massive. Now, it's huge for women because we don't go into menopause with as much typically as men do. But this whole sarcopenia thing is becoming a bigger issue worldwide, and it's going to continue to be an issue, and we have to be able to figure this out. Fat loss, body composition is massive. Libido, peptides can actually help with libido. They can also help with skin and aesthetics. So lots of other stuff, but let's just start from here. So as I said earlier, the hormones I'm going to really talk about, and I'm not going to go into detail here, but all I wanted to say is when I say hormones, usually people think of estrogen, progesterone, maybe testosterone. But I want to make the point that the hormones we're talking about is all of them, right? So when we talk about the adrenals, we're speaking to cortisol levels. Now serotonin's not a hormone; it's actually a neurotransmitter. Sorry, melatonin is a hormone. And dopamine is a neurotransmitter as well. But the point is that all of these compounds that are so critical to our functioning are going to be influenced by some of the things we're going to talk about today. So adrenal and thyroid gland exhaustion and imbalances. So these are, as we know, rampant. And so in addition to all of the things that you're learning about, or you have learned about, or all of the tools like the herbs, the lifestyle practices, all of the things that we know and we learn about in our studies at IHN that are very powerful, there's also ways of actually regenerating the organs that are most linked to this function. And these funny looking names, glandocort, thyrogen, pineolon and sirlutin, epidolon and endolutin, these are names of bioregulator peptides. So let me stop for a second here and talk a little bit about what bioregulators are, how they work, and where they come from. So what they are 2 to 4 amino acid chains. So that means there's no more than 4 amino acids arranged in space, and as few as 2 amino acids arranged in space. And what they are able to do, because they are so tiny, is they can cross the cellular membrane, they can cross the nuclear membrane, they can bind to DNA. They will there bind to DNA, right? And they will therefore trigger the upregulation of production or rejuvenation of whatever tissue, gland, or organ they are targeting at a cellular level. So it's pretty amazing if you think about it. It's a little bit like if you were able to say, oh, the tread on my tire is getting worn out. What if there was a way to restore the tread on the tire? And that's a little bit what the bioregulator peptides kind of do. They were discovered in Russia almost 40 years ago by a doctor by the name of Professor Vladimir Kavinson, excuse me, who was in the military in Russia and was tasked with the job of figuring out a way to help the military who were coming back from nuclear submarine missions or space missions, kind of like they'd aged ahead of their time, right? And so they gave this young guy the job of figuring out how to do exactly what we're doing here, restore health. And bioregulator peptides were used extensively after Chernobyl. And I know this for a fact. Not only does the literature say it, but I know this for a fact because I have a very good friend who is a practitioner in this space who is Russian and was in Russia at the time of the Chernobyl accident. Her grandfather was working at Chernobyl, in the nuclear space. And so she was, to this day, she's dealing with side effects. But nevertheless, she was able to have a child. And it's obviously healing has been a lifelong journey for her, but bioregulator peptides have been central to all of the things that she's done to heal herself. So going back to what's on this screen, so where bioregulator peptides actually come from is the biological version of bioregulator peptides is extracted from the tissues, glands, and organs of animals, usually cows, but it can be pigs, it can be sheep, depends on where they're coming from. But essentially, you take adrenals from one of these mammals, and they can the adrenal can be it'll be dried, desiccated, processed, and the peptides will be isolated and extracted. They can be taken as nutritional supplements. So these are capsules, or they can be otherwise they can be used also. So that's the biological extract. So that's the actual extract from the tissue can be basically used as a capsule. And it looks white. So it's so highly processed and it's so highly refined that you're essentially not having any real protein from the animal anymore. You're really left with the active bioregulator peptide and possibly some other cofactors around it. Now, another thing that's happened in the bioregulator space is that scientists have isolated that 2 to 4 amino acid chain and have been able to synthesize it in a lab. So we have the biological version, which is the actual extract, or we have the synthetic version of bioregulator peptides. And those synthetic bioregulators can be administered either by injection, or there's now companies that are making them as sublingual sprays. There's yet other companies that say that they can deliver them transdermally. So you can imagine that these are the tiniest of tiny proteins, and they will get through pretty much anywhere. I would say of those methods, I can tell you that the subcutaneous injection is the most efficient. The sublingual is fantastic because, as you know, we absorb very efficiently through the buccal membrane because there's so much vascularization under the tongue. The synthetic peptides can be absorbed beautifully through there and get right into the bloodstream. There's no pass through the digestion tract. So, it's very efficient. So that's another very effective way of administering them. So in the case of adrenal and thyroid gland imbalances, we have here the adrenal bioregulator called glandocort. So you can see the cute little adrenal glands on top of the kidneys on either side. We have thyrogen, which is the thyroid bioregulator. We have pineolon or sirtuin. So the bad news about bioregulators is that the names are horrible, and every bioregulator has more than one name, depending on whether you're talking about the biologic form, as I explained, or the synthetic. So pineolon would be the synthetic, sirtuin would be the biologic. And what we're talking about here is the central nervous system and brain. And then finally, we have the bioregulator that probably, if you've heard of any bioregulator at all, it's probably this one called epitalon, which is a synthetic name. Endolutin is the name of the extract of pineal glands, and this is the pineal gland bioregulator. So why is the pineal gland bioregulator the most famous? Frankly, it's so famous that it landed itself on that list of the FDA that reclassified all those peptides in November as class 2 compounds, meaning that compounding pharmacies are no longer allowed to compound them, which is, it's a heartbreak, right? Because there's so many functional medicine doctors in the US that, in particular, who are using peptides so effectively to move the needle with patients who just don't respond well to conventional medicine. Plus, as we talked about earlier, the way that peptides work is so much friendlier to the body and so much more respectful to the body processes. We're completely missing the plot here, right? Anyway, I digress. So why these four for these issues? Well, it's obvious that adrenal and thyroid make sense. Adrenal and thyroid glands work hand in hand. And for me, if I have someone who's showing that their adrenals aren't functioning or their thyroid isn't functioning, I'm generally going to use both of those bioregulators at the same time. I'm also going to administer the pineal gland bioregulator because the pineal gland is responsible for your circadian rhythm. It's responsible for melatonin production. It's responsible for it's responsible for activating telomerase. So this is why apiteline is very much in discussion in anti-aging spaces, because telomerase, by activating telomerase, which is the enzyme that preserves the telomeres on the ends of your DNA, it's going to preserve telomere length, which is going to make it easier give you longer runway, if you will, with DNA replication. Now, but the pineal gland, the number 4 feature of the pineal gland is that it is the master endocrine regulator. So it doesn't mean that if you use the pineal gland bioregulator, all of your hormones are magically going to fall into balance. But when we're trying to balance hormones, it's a really good idea to include it because it works in conjunction with everything else. So another thing that I want to say about bioregulators, and I'm kind of weaving extra content in here because when I did this presentation, it was to a group of people I had already presented the Bioregulator 101 presentation to, which you guys are not getting. And I want to make sure that you get at least the basics and kind of have an understanding. And one of the things that's very important to keep in mind when it comes to bioregulator peptides in particular, and that is that they modulate function. So it's essentially like they are adaptogens. So you can use the thyroid gland bioregulator with someone who is either hypothyroid or hyperthyroid. And what it's going to do is it's going to try to bring the thyroid back into balance. And that is the hallmark of bioregulators across the board. So we don't have to worry that which side of the coin they are on, if there's either overfunctioning or underfunctioning. Ultimately, what it's going to do is try to bring balance back to the system. Okay, what's next? Fertility, as we know, a big fat issue. So can bioregulators help with fertility? 100%. 100%. And so I'm just going to speak quickly to a couple of the new ones showing up here. So we have glandocort, the adrenal glands, because very often adrenals have to be optimized to bring fertility back online. Same with the thyroid gland. I'm not teaching you guys anything you don't already know. We obviously need the pineal gland bioregulator on board because it's from a top down, helping to regulate the whole hormonal system. We also want the central nervous system bioregulator on board, I believe, because you could probably take this down a couple. Not everybody would use the central nervous system bioregulator, but I believe that it definitely plays a role in overall function, hormone function, nervous system regulation has to be there for fertility to be optimized. Now, when we're dealing with women, we're going to use the ovarian bioregulator. And if we're dealing with the male side of the equation, obviously we'll use testes. There is a bioregulator for the testes. And anecdotally, I will say that I have seen this work to help people with fertility. And I've also seen it work in women who had lost their cycles. They're kind of doing everything that they can to get their cycle back. The last piece we bring in is the bioregulator peptides. And sometimes just with epidolon and the ovarian bioregulator, we see a resumption of the menses. Also, we're seeing women going through perimenopause who sometimes are able to delay full onset of menopause, just basically by preserving the longevity of the ovaries. Now, in the bottom right-hand corner, there's one bioregulator, for those of you eagle eyes who may have noticed, that I haven't talked about yet, and that is Ventavort or Vesugin, and this is the blood vessel bioregulator. Now, the blood vessel bioregulator, like epidolon, is one of the main bioregulators that underpins almost every and any protocol. And that is because without healthy blood vessels, without proper blood flow, both through your arteries and your veins, but even at a microcirculation, we know that nothing's going to happen. We know that cellular health is dependent on bringing nutrients to the cells and removing waste products. And that microcirculation is critical, just as the macrocirculation. So that blood vessel bioregulator just pops up almost in every protocol that you'll ever see in this space. Okay, when it comes to menopause, we're going to see the same players pretty much. It's not going to change that much. It's just that maybe our goals are different, right? And we are going to be supporting the body differently in all the other ways. But ultimately, it's about supporting all of those systems and organs that are starting to get tired or show signs of fatigue. Okay, so for cardiovascular health, at this point, you probably couldn't guess that we are going to be using the blood vessel bioregulator. It's going to be critically important, but we're also going to be using, there's a bioregulator for the heart. And so we have the heart bioregulator, the blood vessel bioregulator, and then the pineal gland bioregulator. Now, cardiovascular dysfunction sometimes also includes the kidneys. There is also a kidney bioregulator. So you can see that when you're playing with bioregulator peptides, what you want to do is basically start to think about the body as a whole, and what are the systems that might be involved that can help to bring balance back, that are basically involved in the imbalances, right? So it could be blood pressure. It could be a blood pressure issue. In cases where there's hyperlipidemia, like imbalanced blood lipids, the liver is going to be involved. So we're going to bring the liver bioregulator into play. And we're going to talk soon, in a minute, I think, gut and digestive health. But even with the bioregulators, we'll talk about it in a minute. I'm not going to go ahead. Okay, how are you guys doing? Am I losing you? Or I see that there's 3 comments here. Thyrogen, yes, I've definitely seen it helpful in Hashimoto's. Could bioregulators be configured to circulate all initially? Yes, tennis. Yes, for sure they can, to maintain homeostasis. Yeah, and it's really about how frequently you're going to use it is going to depend on your current state of health and your age. Right? So, and it depends on what's going on in your body. If you can see that, let's say your blood sugar regulation is really off, you're going to lean into the pancreas, the liver. You're obviously going to do blood vessel because you always need to do blood vessel. You're going to throw in the pineal gland bioregulator once in a while, and you're going to apply all of the levers that you know how when it comes to nutrition and when it comes to lifestyle and all of the other pieces of the puzzle. So never forget that all of the other pieces of the puzzle are going to be really critical. Okay, so I'll stop every once in a while and look at the questions. So if anybody has questions, just type them in there and I'll maybe answer some of them as I go along. Okay, so did you know that gut issues affect women more than men? I didn't know that until I researched it, but it turns out that according to the American College of Gastroenterology, women are 2 to 6 times more likely than men to suffer from IBS. And part of that may be because of our changes in hormones during menstrual cycles. Women seem to have higher levels of stress and anxiety. I feel like that's a huge generalization. I'm not sure that it's as true now as it may have been in the past. And typically we have slower transit time than men. And also our hormones do come into play. So regardless, one thing I will say here, if there are any guys in the room, these peptides for gut health are going to be just as applicable for you as they are for women. So here's what peptides, and now we're going to talk about the bioregulators a little bit, but we're going to talk about the longer chain peptides. So let me take a break and talk about what are long chain peptides. They are amino acid chains that are 50 amino acids or less. So they're proteins or peptides that are anywhere from 50 amino acids down. The difference between them and the bioregulators is that though these longer chain peptides typically they can't get into the cell, they're too big. So they have to work through messaging. So they have to bind to receptors on the cell and initiate cascades at a cellular level. Now, there's exceptions to this. There's a couple of what are not in the bioregulator group of peptides that are only 3 amino acids long. And one in particular called GHKCU that we will talk about in a little while actually affects over 800 genes in the human body, and it helps to reset genes to a more youthful expression. It's pretty amazing, actually. So let's get back to peptides for gut health. And here's what peptides can do when it comes to gut health. They can help to reduce and manage inflammation. They can help and assist in sealing tight junctions. So when you have leaky gut, they can help to heal gums, right? So we'll talk about peptides that literally are effective on the entire GI tract, from the point of entry to the point of exit, and they heal anal fissures. Now, it may be weird to you that I haven't included this, but that's because a lot of the animal studies, they did animal studies on, I think it was mice or rats that they did horrible things to. So they developed these anal fissures, and they just put this one peptide in their drinking water, and it helped them to heal rather dramatically. But here's what peptides can't do. And so this is why we still have to do all the other work. They cannot reestablish your microbiome. If your microbiome is out of balance, and I know that Shidozi Ojibor presented to you guys, I think it was last week or the week before from Vitract, we need to make sure that we're always testing the microbiome and adjusting it as we go, because otherwise, as powerful as peptides are, the results will not stick. They won't overcome a bad diet. They can't overcome the effects of chronic stress. So it's a little bit like, I'm going to toxic exposure. It's really a little bit like, ultimately, it's like you're bailing out a leaky boat, right? So if you've got all those other things at play and you're going to apply things that I'm going to talk about here, you might feel, or your client may feel a bit better, or you may feel a bit better, but you're not going to resolve the issue. And let me repeat that these peptides, especially the longer chain peptides, are not meant to be used. They shouldn't be necessary indefinitely. And there's going to be exceptions to that in certain cases of chronic illness. But as a general rule, these are interventions. So they should be used for a period of time to promote healing while you're doing all the work to clear whatever the drivers of dysfunction are. And that way you can then step away. So BPC 157 is a 15 amino acid peptide. It is a fragment of a peptide that is naturally occurring in the human gut secretions. So it gets a buy. So most of the bigger peptides, you will hear or read that you can't take them orally because they'll just be digested as if they were proteins. This peptide, because it originates in the gut, actually gets a buy. It doesn't get digested as protein. There are forms that are more stable than others, but definitely BPC 157 can be used orally, and it is very effective for gut issues. Oops, sorry, I lost my cursor there for a minute. Okay, so I refer to it as the Swiss Army knife of the peptide world. It can be administered orally, topically, intranasally, by sub-Q injection, and it can even be injected into eye drops. So sub-Q, for those of you who are not familiar with that term, is subcutaneous. So that's basically using an insulin needle, and it's just injected into the fat layer under the dermis, under the skin. Now, that is the administration that has come under fire by the FDA. What's really interesting is they don't seem to have a problem with oral BPC 157. So there are a number of companies, and I'm going to refer to a few of them as we go, that sell oral BPC 157 as a supplement. It is not as efficient for musculoskeletal injuries because BPC 157 is also very good for musculoskeletal injuries like tendons, ligaments, muscles, pulls, tears, rotator cuffs, the whole 9 yards. That is the best way to get the most efficient way to get BPC 157 is through subcutaneous injection, but oral BPC 157 is very, very effective for the gut. It's also protective of the organs. So BPC 157 protects the pancreas, it protects the liver, it's protective of the brain. It's been shown in some animal studies to prevent TBIs. And certainly to heal faster from TBIs. Now, the paradox here is that there is a small percentage of people who take BPC 157, and even though the research says that it is dopaminergic, serotonergic, and GABAergic, so it balances the neurotransmitters in the brain, there's a small percentage of people that actually get super anxious and can have some real significant neurological issues when they use BPC 157 in terms of depression, anxiety, anger. And so, this is where what we don't know is we don't know why those people respond that way. And so the advice I give people is if you're going to use something like this compound, then be very aware of how you're feeling, keep a diary, and at the first sign of mood changes or anything like that, you want to stop taking it immediately. Okay. So that's an important point to make. And I feel like not enough people talk about it. And like I said, for gut healing, it can absolutely be taken orally. And I will say that even though it's more efficient to administer it subcutaneous injection for healing of tissues like tendons, ligaments, that kind of stuff, we hear it time and time again. We have people who are saying, yeah, I was taking BPC 157 for my gut and, my sore knee stopped hurting, or my back stopped aching. So it has analgesic and anti-inflammatory effects. And plus it actually actively stimulates healing. KPV is another one of those 3 amino acid peptides. It doesn't necessarily interact with DNA, with the genetics, but it is a really cool compound to reduce inflammation, particularly in the gut, although it can be effective systemically as well. It is also orally bioavailable. So what's happened now is with this action by the FDA, what we're seeing happen is that there's much more emphasis being put on the oral peptides. The problem is that a lot of them are too big to be orally bioavailable, and people are getting really creative. But that being said, KPV is a 3 amino acid chain that is a fragment of another peptide called melanotan. Some of you may be familiar with melanotan. It acts on the alpha MSH receptors. It stimulates melanin. So basically, it's called the Barbie doll peptide because it will make you tan, amongst other things. And we'll talk about it in a minute. It was notoriously and is notoriously used by in the bodybuilding community, the melanotan one. But KPV is a fragment of it, and it's really effective as an anti-inflammatory. Another peptide, and this one is under patent by a drug company. I think we're going to see it come out as a drug any minute. And lorazepam is in phase 3 clinical trials to treat celiac disease, and its superpower is actually tightening those tight junctions to seal the gut. Now, if you were in the Vitract meeting, probably Shidozi may or may not have spoken to this directly, but what I want to say about healing the gut and the forgotten piece is what are the gut bugs that are present and what's happening with short chain fatty acids. So very often, if you have a deficiency in the bacteria that are producing short chain fatty acids, in particular butyrate, what you're going to see is a degradation of the mucus layer of the gut. And when that happens, you can use these peptides. They will help to reseal the tight junctions, but they're not going to bring back your mucus layer. So you have to get the lasting, amazing results, what you need to do is rebalance the gut microbiome, and these compounds will also will then finish the job. And of course, you've corrected the diet and whole 9 yards. Now, remember I talked about GHKCU earlier. So this little peptide, So GHK, the CU stands for copper. This little peptide is incredible. So this is 3 amino acids long. There are a lot of people who believe it should actually be designated as a bioregulator peptide, but it's not. We're not going to get into that. We don't have time for it. But bottom line, it is an incredible healing peptide. So I'm going to interrupt myself because I can see there's more questions. So let me just see what's there. So if my person who suffers from depression, is this recommended? You know, Miranda, it's a really good question. And I personally might be inclined to not go there. Yeah, for the BPC 1757, I kind of knew. It's a really good question. I might be inclined not to. Or you would want to start at a very low dose and really monitor the person to see, are they holding steady? Are they getting any better? And you know, it's going to depend on why the depression is there. If they have gut issues, so I would say, you know, feel your way, but go very slowly with this. Okay, so for GHK copper, it restores youthful expression in 600 to 800 genes. And those are studies that were done in, I believe, at Stanford in the States. So American universities are no strangers to these things. And it's also been shown to be beneficial for the gut lining. But it's also very powerful for wound healing. It's very powerful for aesthetics, which we'll talk about in a minute. And because it's only 3 amino acids, it may be orally bioavailable. So where are you going to get all this stuff, right? So one of the things that I've talked about is sourcing. So if you're ever looking for any of the products that I'm talking about here, they'll be on my website, natniddam.com. There's a section called Nat Recommends, and there's a page for bioregulators, and there's a page for peptides. And in there, you will find the listing for the manufacturers. You will find links to episodes of the podcast that I've recorded specifically with, you know, there's one with Kyle Vanderleest from Level Up. There's a couple with Kent Holtor from Integrative Peptides. Like, we've got a bunch of different episodes. You'll find those. You'll find links to buy as well as discount codes. However, because I'm talking to a bunch of people who are practitioners, if any of you decide at some point that you want to open a practitioner account, particularly with Level Up Health, I can introduce you to the owner, and I can help you out with that. So just let me know. Okay, so whoops, let me go back. Sorry. So there should have been a picture, but there's no picture. In any event, they have a product called Ultimate GI Repair, and it includes BPC 157, KPV, lorazepatide, GHK copper. It also has tributyrin, so it has your butyrate, in case your butyrate producers aren't functioning at their highest level. It includes zinc carnosine. It has L-glutamine. It literally has the most comprehensive stack of healing compounds for the gut, so that you can apply this. You can have your client taking this while they're doing all the work to clean up the diet and clean up their lifestyle and do all the other things. And it's really quite something to see how after 30 days, many people really make a lot of progress. Obviously, depending on the issues, sometimes they may need to use it a little bit longer, but this guy does not fairy dust his supplements. Like, they're really high-powered, full tilt supplements, so they're expensive. But if you were to build that stack on your own, it would probably cost you 3 times the price of a bottle. So hang on to your shorts. It's expensive, but I think if people are willing to go there, it's really worth it. So this is a little bit what I was talking about before, the whole issue of proper gut balance to ensure production of short-chain fatty acids. And he also has actually on its own a tributyrin supplement that also includes a couple of species of probiotic to support the gut production of those bugs that we need to make those short-chain fatty acids. So he's got a couple of very, very interesting formulations. Okay, so can we use bioregulators for gut health? So the truth of the matter is, bioregulators are more of a long game, right? So what are the things that are playing a role in our loss of function in the gut is that as we age or with stress or toxins, we have a decrease in digestive enzymes. And so that in and of itself leads to digestive issues. The pancreas starts to lose a little bit of oomph. It's not working as well as it should be. The liver always needs love, right? I mean, it's our workhorse. We need it. If there's an organ we need to rejuvenate, definitely the liver is going to be at the top of the list. So we have bioregulators for all three of those, right? We have a pancreas bioregulator, we've got the liver bioregulator, and we've got the stomach bioregulator. Stomach bioregulator helps to restore the cells, the chief islet cells that produce the HCl. So that's going to be helpful in restoring function. Of course, you're going to want to make sure that people are hydrated, they're not deficient in zinc, they don't have an overgrowth of H. pylori. All of those things are going to be critical, but the stomach bioregulator is going to be helpful in plugging the holes where we've had damage, right, to the organ. Same with the liver, same with the pancreas. Okay, how are we doing? Are you guys awake? Are you still with me? I feel nervous when I can't see anybody. Okay, I'm going to assume you're still there and awake. Yes. Okay. Thank you, Renata. Okay. All right. Are there questions so far? Does anybody want to ask anything else before I keep going? It's going to get exciting now. This is going to be the most contentious part of the presentation. Okay, here we go. Body composition and fat loss. Woohoo. Would someone with copper toxicity so you wouldn't have copper toxicity from, birth control pill or copper IUD. Yeah, Emily, that's a really good question. I might want to resolve that copper toxicity or rebalance it. I think you've probably had Lisa Patel Killa talk to you guys. I'd go back to her presentation and think about that and rebalancing that. You'd need to be careful with the GHK copper. Interestingly enough, you can use GHK without the copper. It just in that GI repair formula, there's going to be GHK with copper. I wonder if maybe you might be cautious with that formula because there's copper added to it. Even though the zinc is there and theoretically they balance each other out, if you're already in a toxic situation, you may need to resolve that before you add it. Okay. How long on average to see effects? So with the BPC 157, it can be very, very quick. It just depends. It depends on the person. And I would say in terms of contraindications, nothing with herbs, nothing with supplements. Other drugs, I haven't seen it. The only thing, like I said, the only thing that gives me pause with BPC 157 is these reports of people that suffer from anxiety sometimes. So GHK requires copper as a cofactor, tennis. So if you're deficient in copper, GHK is not going to be able to work for you. So, in a perfect world, we would all do a ceruloplasmin test and assess our zinc and copper status, and then we would be able to pick GHK or GHK copper. If you're using, if you're using GHK topically, whether it's for wound healing or for skin, you would want to have the GHK with the copper because it's not going to be able to access the copper systemically. So hope that answers your question. Okay, I'm going to keep going now. Whoa, what just happened? I think I skipped some steps. Body composition. Okay, no. This is what I wanted to do. Okay, for fat loss, the slow build, the people who want to do this on their own with no training wheels, do it themselves. They're going to do it with diet. They're going to do it with lifestyle. They're doing it with exercise, with balancing their hormones, like the microbiome, all of those pieces, right? And theoretically, that should be what we're all doing to maintain healthy body composition. But the bioregulators that can be helpful here, especially when there are imbalances in these systems, are going to be things like the pancreas bioregulator, the liver, the stomach bioregulator, because we know that so many people don't produce enough digestive enzymes, then the thyroid, adrenals, central nervous system. These obviously play a massive role in body composition. And finally, the pineal gland, right? So that master endocrine regulator, and especially if people aren't sleeping efficiently and well, we know that that's going to wreak havoc with their insulin and their blood sugar regulation and the whole 9 yards. So the bioregulator peptides can really be brought into protocols where we're working with people on healthy body composition. Now, in the peptide world, there's a couple of other ways to go. So first of all, to support the bioregulators, you can also use supplements like these. So this total body recomp, and you're going to have to excuse my buddy Kyle, who I adore, but he does have a bit of a bro view of the world. So his packaging looks a little bro-ish. But this formula, the total body recomp and Ignite Plus by another company called Longevity, these are fabulous stacks for people who just want to do the work. They tap into things like there's a peptide called DNF10 that can be very effective at helping to reduce appetite. There's also bitter melon in there. You've got mitoburn. You've got a form of dihydroberberine where, if you're using berberine for blood sugar control, you need to take, 100 milligrams 3 times a day or 150 milligrams 3 times a day. With dihydroberberine, you can take 50 milligrams a couple times a day and you're good to go. So these two compounds are very effective. The thing with them is they will take a minimum of 30 days to really see any kind of results. Like it takes time. So like I said at the beginning, to do the bioregulators and to use these and diet and exercise, this is the long game. This is where you have a client who's ready to lean in, do the work. It's going to take them a while. They're okay with that. They're good with it. For the people who don't have the patience, or for people who are very insulin resistant and have major metabolic imbalances, we do have Ozempic and Mounjaro. So these are the fat loss peptides, and they have become both the darling and the pariahs of the peptide world. These are peptides that were developed this is where pharma took peptides from the body and worked on them to give them a longer half-life so that they would do the work that they do. And the good news is that they work really, really well. They do it. And the reason why they're so great is because they're not a one-trick monkey. They don't just reduce or limit appetite. They increase resting metabolic rate. So you burn more calories at rest. They slow down gastric emptying. And I would say, I believe semaglutide slows gastric emptying more than tirzepatide. Tirzepatide leads into a couple of different pathways. They reduce hunger and cravings, not just because you stay feeling fuller longer, but also because they act on the center in the brain that drives those cravings. And so they're even being researched for all kinds of addictions because they can be helpful to reduce that addictive piece of the puzzle. They improve insulin sensitivity. So they improve basically your cells' ability to take glucose up and store it in muscles. So this is where, people who are like taking these and say, well, I don't need to exercise, they're completely missing the boat. So I'm going to talk about that in a minute because this should actually make it easier for you to exercise. It's also good for the heart because if the heart becomes more insulin sensitive, then it's going to be able to get more energy. They even improve the release of insulin by your pancreas in response to ingested glucose. And like I said, improve the uptake of glucose into skeletal muscle cells. There's benefits for the brain. There's benefits for the heart. There's benefit for the kidneys. They're being researched for treatment of Alzheimer's because what happens in certain cases of Alzheimer's and dementia, that insulin resistance happens in the brain. So if the brain becomes insulin resistant, neurons start to die. So if we can restore insulin sensitivity in the brain, all of a sudden we're getting ahead of these things. And like I said, benefit for the heart and the other organs. The bad news is we're dealing with in society right now, Ozempic and Mounjaro shaming, people saying, oh, feeling like maybe it's like cheating or something. I think it's a lever that can, if used properly, if you use your superpower properly, it can be a really, really incredible tool. There is a risk of pancreatitis, and I've definitely seen this happen. So what a lot of physicians will do is they will prescribe BPC 157 alongside these medications, because BPC 157 protects organs, right? And you might even do a couple of rounds in the pancreas bioregulator. But definitely it's a good idea to take the load off the pancreas. And how do we do that? Well, we don't eat a high glycemic diet. We cut out alcohol, maybe, which we should be doing anyway, right? There is, in rats, there was observed a higher incidence of a very specific type of thyroid cancer. It has never been observed in humans. However, any human with a history of thyroid cancer is warned, and rightly so, until we have more information, to stay away from these peptides. The whole issue of Ozempic face. So this is when people lose a lot of weight and their face kind of caves in. Well, this happens when you lose a lot of weight, no matter how you lose the weight. It's just that with Ozempic, maybe it happens a little faster. Where you lose that weight is genetically determined, right? So I'm not saying Ozempic face isn't a thing, but I'm saying that it's going to affect some people more than others. I think it's smart to go slow with these so that people are not losing weight too fast. And what I see happening very, very often is that people are like, okay, I've got 50 pounds to lose. I want to lose it now. And you know what? It took you a long time to get to where you are. Give your body time to adjust, because over time, the cool thing is that over time, if people do the work, which I'm going to talk about what that looks like in a minute, their body, their chances of holding on to those results down the road are way higher. And I know that we read a lot about how people get the rebound weight. So we'll talk about that. And this is a piece of it. Muscle loss. When you lose a lot of weight, your body, you're automatically going to lose some muscle. But you will lose a lot of muscle if you don't eat protein, if you don't exercise, if you're hypocaloric at all times, which you will be using these things. The body's not going to prioritize muscle. So you might lose a little bit of muscle, but you can control how much muscle you lose by exercising, by prioritizing protein intake, and by getting enough sleep, by doing all the things. But just by exercising and prioritizing protein, and for many cases, I get people to use essential amino acids just so they give their body those building blocks of protein, particularly because they just don't have enough appetite. So they, as it is, most people don't eat enough protein, but when you put them on, when they use these compounds, they almost never get enough protein. And then the rebound weight. So the rebound weight is a feature, to me, if people haven't done the work. So the invitation when you're using these compounds, change your eating habits, re-educate your palate, lose the bad habits in the kitchen, take up exercise, find something that you love, build lean muscle. Because if you lose weight, build muscle, and adopt a better diet, you will not have rebound weight. You will have rebound weight if you use these products, lose 30, 40, 20, whatever, however many pounds. And then when you come off of them, you just start eating just like you did that got you there in the first place, right? You go back to eating all the crap. You didn't exercise, you lost a bunch of muscle. There's nothing in your body left to burn the calories. You didn't pick up new habits. So for people who choose to use these, it is imperative that they do the work on the diet and the exercise and the lifestyle piece so that they're using these as training wheels and not as a crutch. Okay, so, the real issue here, I've already just said this, I don't want to repeat myself, but all of these things and even underlying hormonal imbalances are going to be really important, whether you're doing it holistically or through bioidentical hormone replacement therapy. However you're managing your hormones have to be managed properly to support all of the benefits that you're going to get. So body composition and building muscle. So this is the other side of fat loss, right? So everybody wants to lose fat, but nobody really thinks about, nobody. A lot of people forget about the muscle piece. And like I just said, when it comes to Mounjaro and Ozempic, it is critical that we think about muscle. So one of the main levers that we have at our disposal is growth hormone. And the bright side of growth hormone is it's actually anti-aging, right? And our growth hormone levels definitely decrease as we age. It's one of the reasons why, as along with the loss of estrogen and all of different things, that our skin starts to wrinkle and that kind of stuff. So growth hormone can be beneficial for the skin. It can be beneficial for the brain, for cognition. It's beneficial for maintaining and building lean muscle. It can even help with losing fat. It's really great for bone density. And bone density, we know, certainly for women primarily, but even men can get osteoporosis. And also immune benefits and sleep. So the bad news about growth hormone is it's expensive. It can produce exogenous growth hormone, can suppress production of your own growth hormone. It can drive water retention. It can drive undesirable growths. And that means if, let's say, God forbid, somebody had cancer cells who had gotten the better of their immune system, you bring more growth hormone onto the table, and it's going to push that cancer, right? And definitely needs to be monitored by a medical doctor. And the other piece of growth hormone is that too much is pro-aging. So for people who want to go beyond the lifestyle interventions that drive growth hormone. So what are those? And I feel it's important to say this. Sauna increases growth hormone. Lifting heavy weights increases growth hormone. Getting proper sleep helps with growth hormone. But people who want to push it a little further, there is a category of peptides. Now, these live in the gray zone. These are part of the compounds that the FDA and Health Canada do not want us to be using. But these are compounds that people, for example, in the weightlifting world and bodybuilding world have been using for decades. Unfortunately, very often not responsibly, but nevertheless, they've been using these, right? And there were other ones that are more problematic and stronger that they were using that are harder to get your hands on the market. In any event, what we have here are CJC1295, ipamorelin, tesamorelin, and sermorelin. Now, these are called growth hormone secretagogues. And the reason for that is because what they do is they stimulate your body to make its own growth hormone. So they act on the pituitary gland and the brain to upregulate the production and the release of growth hormone. Now, what's really cool about these, quite apart from the fact that they're going to help you to make muscle, is the way that a lot of people will use them is they'll use them with BPC 157. Remember, we talked about BPC 157 in gut healing. BPC 157 also really great for healing and maintenance of skeletal muscle and tendons and ligaments. So one of the things that BPC 157 does, it actually upregulates the expression of growth hormone receptors, right? So you've got your catcher's mitts waiting for the growth hormone. At the same time, people will use growth hormone secretagogues, which upregulates the release of their own growth hormone so that then there's more growth hormone around to be caught by the receptors. So they work hand in hand really nicely when it comes to resolving injuries. Sometimes you'll have athletes that will use them during heavy training cycles because it helps them to recover faster from their workouts. These compounds are also, by the way, banned by the governing bodies of competitive sports, unfortunately. In any event, these are, for the most part, administered by subcutaneous injection. I believe ipamorelin can be used intranasally. I've been hearing that lately. There's a question. Hang on. Will there be a replay? Yeah, I don't know that the slides are going to be, there will be a replay because I know that this is being recorded. I can see the little red dot. So I think that you'll probably be able to get the recording. Okay, so the cool thing is, so here's the upside of growth hormone secretagogues is that they are more affordable. They're not as strong as exogenous. They won't suppress your own production of your own growth hormone. They have many of the same benefits as exogenous supplementation, but not as strong. And they can also be really helpful for sleep. In particular, sermorelin. People take it at night, and it can be really, really nice for deep sleep. The bad news or the cautions, and this is especially if people use too much, it can drive water retention and joint pain. There's a higher number of people I find have site reactions. They can have a histamine or allergic response to this category of hormones, so you have to watch out for that. If you have one of those reactions, at the end of the day, you need to just step away. There will be a transient increase in blood pressure. So for people who have high blood pressure, sometimes these can be contraindicated, and less is more, obviously. So just because you get good results at, let's say, a dose of 150 or 200 micrograms at night, doesn't mean that 400 micrograms is going to be better. On the contrary, you might just tip yourself over the edge of what your body will tolerate. And obviously, we want to avoid these completely in the presence of cancer. So we're now getting really into this whole space of biohacking. And, it's a bit of a slippery slope. I think that people can be sometimes a little bit cavalier about peptides in general. And I think that we need to be mindful that they're very powerful, because we're talking like micrograms in doses sometimes, and they produce very powerful effects in the body. So they can be very powerful, but we just have to be mindful. So are there bioregulators that support muscle? You betcha. There's a muscle bioregulator called Gotratix. There's a bone marrow bioregulator that can help with stem cells. And Cartilax is another one of my favorite bioregulators. That is the cartilage bioregulator. How it works is it upregulates the production of collagen and elastin. And that is important, as you people already know. It is important not just for muscles, but it's important for tendons, ligaments, skin, any organ that has to expand and contract. So think blood vessels, your heart, your kidneys, all the organs, all of them have collagen and elastin. So anything that's going to help to upregulate that pathway and that rejuvenation is going to be beneficial to our aging process. Okay, bone density, big issue as well. So there's bioregulators that can really help here. We have the parathyroid gland bioregulator, we've got the cartilage bioregulator, and the pineal gland bioregulator as well. But none of these are going to do anything if nutrition's not in place and if exercise isn't in place as well. And obviously, again, hormones. So I alluded earlier that there is a peptide for libido, and that peptide is called PT141. It is yet another fragment of the melanotan peptide, and it works both on men and women, and it acts on the brain. So this one's so exciting that a drug company actually grabbed it and created a drug. I'm trying to remember the name of it, but there is a drug that comes from PT141, and it is quite good and quite expensive because it's coming from the drug company. The downside of PT141 is if you dose it too high too fast, it can cause nausea. All right. We're coming into the home stretch, ladies and gentlemen. We then get to skin and aesthetics. So, of course, anything that can help our health and that is as powerful as these peptides and bioregulators can also be very powerful for skin aging. So we have the melanotan 1 and 2. Not only does it upregulate melanin, but also helps to thicken skin. So it helps to reduce wrinkles to a point. The only challenge is they will also increase tanning. And if you have any sun damage, I can promise you that the first thing that's going to come up is going to be the sun damage before the background kind of catches up. In redheads, what we've seen is like a massive increase in freckles, and this will happen in anybody else, but over time, even their hair will get darker. But it does help it does help them to withstand the sun a little bit. We've got GHRH and GHRP, so those are your growth hormone secretagogues, will be good for skin. Our GHK copper, this is the superstar when it comes to skin. So I will direct you to a podcast I recorded and released 2 Fridays ago with a company called Vitali, and they make a brand of skincare called Vitali Skincare that is all based on GHK copper peptide. And although it's expensive, it's really, really great stuff. And we talk about how to use it on the podcast, and they also distribute out of Canada. So a lot of this, the Vitali skincare line, you can buy it. It ships out of Canada, so you don't get stuck with a giant customs and duty bill on the other side. The bioregulators important for skin. We've got the blood vessel bioregulator because, of course, blood flow to the skin is critical. Epitalon, interestingly enough, is powerful for skin. The pineal gland bioregulator, Cartilax, because of the elastin and collagen, and Villon, which we haven't even talked about, which is an immune bioregulator, but actually also very powerful for fibroblasts. There's another bioregulator that shockingly never came up in this presentation, I just realized, and that is the thymus gland bioregulator. And that is a critical bioregulator. So if you said to me, you can only have 3 bioregulators till the end of time, the 3 I would pick would be the pineal gland bioregulator, the blood vessel bioregulator, and the thymus gland bioregulator. Because, of course, without a healthy immune system, we've got nothing, right? So I'm just going to leave you with a couple of stacks here for a foundational healthy aging stack of bioregulators. I would combine the pineal gland, the thymus gland, and the blood vessel. That would be your foundational stack. And then I always get to the end of this presentation and run out of time to talk about all of the other things that we know we need to do to optimize the terrain so that bringing in bioregulators and peptides can really do their thing, right? So STEM Regen, this is a podcast that came out today. If you guys are interested to know how you can tap into the power of your own stem cells without going to a clinic in Mexico, this would be a great episode for you to listen to. Essential amino acids, those are the building blocks of protein, really important, especially for people using those fat loss peptides. Senolytics, anything we can do to reduce our senescent cell load as we age is going to be beneficial to creating that proper terrain. Spermidine is a compound. We could do a whole presentation just on that. And if you've never heard of spermidine, go to natniddam.com, go to Nat Recommends, the supplement page, look for Primadine or Oxford Healthspan, and click on those podcast episodes so you can learn about it. Not to buy anything until you've learned about it. Rapamycin is another one that's gotten a lot of attention. Taking care of mitochondria, your nutrition, sonic, cold exposure, exercise, circadian support, light exposure, all the things. And that's it. That's all I got. Oh, no. And at the end of the day, what's the most important thing? The most important thing: gratitude, joy, and community. These are the things that are going to keep us young. These are the things that are really going to anchor us in our wellness. So I think that's it. I think that's my final slide. The podcast is the Biohacking Superhuman Performance Podcast. It will be the Longevity Podcast with Nat Niddam as of 2 weeks from now. I cannot tell you how excited I am about that change. I've got a membership community you can learn about on natniddam.com if anybody's interested in interacting with me further. And
Awesome.
yeah, I think that's it. I don't think there's any other. So yeah, natniddam.com. And that's
Thank you
it.
so much. That was awesome. And I appreciate you staying a little bit later for us to get through all
No
of that
problem.
stuff. Yeah. Thank you
No
so
problem.
much.
Sorry, I was a bit long, but it was also because I tried to build in some of the stuff that wasn't in this one, and I wanted to make sure people had a little bit of background.
Yeah. Awesome. Yeah. And natniddam.com for to check out the podcast and learn a little bit more about these peptides. That's awesome. Yeah. Thank you so much.
My pleasure. Thank you guys for showing up. I really appreciate it. And I think that's it. Is that it?
Yeah.
Okay.
Okay. Thanks, everyone. Thanks,
Take care.
Natalie.
Bye.